Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about a Bartholin cyst and also Bartholin cyst abscess. So your vagina has some lubricating glands called Bartholin glands, and they are at the opening on the sides and have little tiny openings that secrete some lubricating fluid. And sometimes those ducts can get blocked, clogged. And if they do, then you can get a cyst that starts to grow, and it can look like a grape on the lower part of your labia, your lips, and it can grow bigger and bigger, get to be like a golf ball size or even larger. It can be quite uncomfortable and definitely noticeable. They can be infected or not infected. You might notice a little one that doesn't change too much and not much needs to be done about it, or it can get swollen and enlarged and cause be infected and cause fevers and quite a bit of discomfort. So if you notice a bulge there, then that's something that you should discuss with your physician, your gynecologist. If they're small and not changing, we don't necessarily have to do anything about it. But if they're growing bigger or if they're infected, then they need to be drained. So we give you some numbing medicine, make a little incision inside and allow the fluid to drain out. If there is an infection, you would get some antibiotics. And generally speaking, after that, if they're able, we put in a little bulb. It's called a word catheter. It's a little like blow-up balloon that goes inside and sits there to allow the opening to heal without closing. Otherwise, especially if it's infected, when it heals up, it'll close back up and then it'll reinflate. So we put this catheter in, you leave it about 1 to 2 weeks. They often fall out after about that amount of time, and allow it to heal with a bigger opening, and that opening allows it to drain, and so it won't reaccumulate. Sometimes they recur. If they keep recurring, we do a bigger surgery where we remove the gland or open it up and stitch it open so it stays open. So bottom line is that if you have a cyst there, they're rarely ever, they can be in older patients, cancerous, but in over 30 years of doing this, I've never seen that before. But I've seen quite a few, hundreds, if not more, Bartholin cysts. So if they're there, it's important for you to see your physician. I encourage you to try to get into your gynecologist instead of going to an emergency room. But if you do have a clearly infected, high fever, lots of pain and discomfort, and you can't get in soon enough, then it would be worth going to an emergency room. They can often drain it and put packing in there, but if they can't put that word catheter, because they don't always have it in stock, that to keep it healing up, then you should follow up with your gynecologist so that they could do that as well. Okay, so if you come in on a Saturday, on a weekend, middle of the night, the office isn't open, you might go to the emergency room at first, but then you're going to want to follow up with your gynecologist to get that word catheter placed. So it can be uncomfortable, it's annoying, but easily treated and doesn't often recur, but definitely needs some treatment. I hope you found this information of use. Please leave your comments. Thank you.